that we are not realizing how many of our cases actually involve trauma and mental health. I think mental health is one of the biggest causes for chronic illness, and trauma being a big sector of that. In functional medicine, one of my big qualms with it is that we say your depression and anxiety could be due to heavy metals or mold or all these things. And I'm like, I think that's a little bit of a cop-out some of the times.
Welcome to the Multiverse, where we believe that mushrooms can actually save the world, and that if humans mirrored the magic and wisdom of the fungi kingdom, we would have a far more joyous and connected planet. Each week, we'll be meeting with experts to learn about everything from functional mushrooms, psychedelic medicines, and so much more. Thanks for listening. Step into the multiverse with us. Hi, guys. Welcome back to another episode of Into the Multiverse. And today, I have one of my closest friends, Dr. Mary Pardee, who also lives approximately 50 feet away from me. I know that people listening cannot see where we're sitting right now, but I can see into Mary's apartment every day, which is such a joy. Mm-hmm. We actually also just had Travis Brewer on the podcast, who's a ninja, and he suggested, wonderful suggestion. I think it would be super into that we connect a Slack line between our two apartments so that we can have a quick way to reach each other if needed.
Yeah, adrenaline.
Right.
And connection.
And safety.
And safety.
Community is immunity, you know? That's the priority. Well, in all seriousness, I'm so excited to have you on the show because not only are you a wealth of knowledge in so many different areas, but I'm really loving all of the work that you're putting out in the mental health space and your passion for psychedelics. You're one of my favorite people to kind of have as a thought partner because you're so into the science. And you just have a really beautiful perspective. So very excited to dive in. And this is your bio. I had to write it down and I'm going to read it because it is technical and long-winded, which is it's very compelling for people that do not know Mary. She is a naturopathic medical doctor and a certified functional medicine doctor. She specializes in integrative gastroenterology, and is also the founder of Modern Med. She has a virtual wellness company that has, telemedicine, has a private practice, and you're an expert in a lot of things, but your main focus areas are gut health, hormone balancing, and your specialties on your website, which are really interesting and wide-ranging, are peak cognitive performance, fecal transplants. Mm-hmm. You are our favorite poop doctor. You're my favorite person to talk to about poop and gut-related things. And you are also really making a name for yourself in the mental health space and putting your message out there around psychedelics and mental wellness. So I'm very excited to dive into all the things.
Me too. I'm excited.
So to start, would love to hear your personal journey, which is actually very similar to mine, except for I didn't go and become a functional medicine doctor, but started with the same kind of core issues and gut issues, and would love to hear how your journey led you down this path.
Yeah. Oh, absolutely. My journey is so changing, which I think is normal, right? So usually when I talk about my journey on podcasts, I talk about it from the gut issues that I experienced as a young girl, which I had IBS, I had colonoscopies, endoscopies at a really young age. Never felt well, went to a bunch of conventional gastroenterologists and, was put on medications. Some of them would work for a little bit of time and then they would stop working, or I'd get side effects, nausea, and things like that would come up. And so I eventually went to a doctor and he looked at my file, and he had my whole chart, and he was just like, you've tried everything. You've tried everything. We've tested everything. You're fine. IBS is not going to kill you. But you're just going to have to live with this. There's nothing else that we can do. And I left that visit and I was like, this feeling of hopelessness, which is one of the worst feelings. There's nothing else that they could do. And so I cried and I really at that point in my life was like, there has to be something else. I just don't believe this guy. I can't feel like this for the rest of my life. What most people don't know is IBS, irritable bowel syndrome, has the quality of life sometimes equivalent to people with end-stage renal failure. So it can be really detrimental to how people interact with their everyday life. And so at that point, I was just like, I need to become the doctor that I have not found for myself. And that's really what my journey's been on in mental or in the health field in general, is just becoming the doctor that I didn't have. And so I treat people with IBS, and I have a whole box of tools to use past the medications. And so I use medications when I need to. And I also have a whole other toolbox of things to choose from, which definitely includes mental health. And so that's kind of where I got to where I was probably 2 or 3 years ago. And then I had a trauma come up in my life where I lost a really important person in my life. So my ex passed away. And from a somatic experiencing perspective, like the gasp that I just took is also like, this like settling of it still really affects me. But he passed away in 2018. And over the next 2 years, I was like really paralyzed. I definitely was depressed, definitely struggled with anxiety, and was grieving him. And then in 2020, I sought the help of an integrative psychiatrist and went down my journey with really healing that grief. And so, this process of my life, it was like all gut health up until that. And now, I've been diving into the mental health because I see there's such an overlap with mental health and physical ailments as well. And so it was really through my own healing journey that I've discovered all of these things. And I started to integrate psychedelics into my healing process as well, with just really realizing it was a trauma that I went through and needing to heal that from a trauma-informed perspective.
I think it's so important that you're sharing like the full breadth of your story, because I know a lot of people that have gone through, whether it's losing someone or some sort of a severe trauma, but they have these physical ailments that are showing up in their life, but there's not really a connection of the dots often. And I think a lot of your work is how do you connect those dots? How do you realize that the physical is the symptom that is showing up, and unless you do the work to process and heal the trauma, then it will continue to manifest in disease, which I'm really excited to talk to you about because of the work that you do. You are actually able to put the science behind why a lot of these things show up in our bodies and how to actually get to the root of them. And I guess that's like a good place to start. Can you define trauma? And the context of this question too is I've talked to so many different people who, some people really believe they have a lot of trauma. Some people believe they have zero trauma. Even if you look at people that you would say their life is arguably traumatic. Does everyone have trauma, and how do you define it?
Yeah, it's a good question. And I think that when we look at trauma, we often think of, especially in medicine, PTSD is like the only diagnosis, right? Post-traumatic stress disorder. And I think we're underdiagnosing trauma issues. I think a lot of people are viewing traumas from not a complex trauma perspective, but from a simple trauma perspective. So simple traumas are things like the death, watching somebody die, the death of a loved one, getting into a car accident. They're distinct events that happen. An earthquake, right? These are like very distinct events that can happen, and you say, oh, that was traumatic. But complex traumas are things like emotional abuse throughout your life. They're harder to actually identify, and they go on for a prolonged period of time. So I really do think that we're probably underdiagnosing issues that are happening because of trauma, because of that, because they're harder to pull apart. But what is trauma? So trauma is when your ability to respond to a perceived threat or stressor becomes overwhelmed. And so what that means is that it's your body is able to overcome stressors easily, then it's not going to be traumatic for you. But when something starts to overwhelm your system, especially your nervous system, and you're not able to overcome it, that's when something can become traumatic. And so it's also when you become disconnected from your community, to your family, to your friends, to yourself, and to your own body. So disconnection is a big piece of trauma too. We see social isolation a lot of the times with trauma. Trauma is a part of human existence. And so we often say, like, we want to avoid traumas, or, how can we get rid of them or solve them, things like this. It's also why we go through human life and become the way we are is largely dependent on the traumas that we've gone through. And so our ability to eventually overcome and move through a trauma creates resilience. And so we can't get rid of traumas. They're unfortunate and nobody wishes them on anybody. But it's also what makes us human. It's what helps us with being compassionate and empathetic towards people. And we really need to experience hard things in order to be able to connect with people on a deeper level too. Which is tough. It's really, really tough. And so your question is, does everybody have trauma? They will at some point in their lives. So 90% of people will go through something really traumatic in their lives. And I think it's 100%. I don't think you can get through life without a trauma. How we define it, like I said before, it can be different for different people, but it can be that your parents got divorced. That can be really traumatic for a child. So we look at things called adverse childhood experiences, which are ACEs for short, and we can see that ACEs really can increase the risk for all-cause mortality as well as certain morbidities throughout life. I actually wrote a few of them down, which I'm going to read to you because I did not memorize them. But we're looking at, these adverse childhood events, and, this is including things like exposure to abuse, household dysfunction, but also divorce. And we can see that they're associated with an increased adult morbidity and mortality and premature death. So 3 or more of the ACEs, so each of them is counted as one, depending on what they are, results in a 59% increase in the risk for diabetes. With each additional adverse childhood event, the risk for diabetes increases 11% more for each additional one. Yeah, it's really, really impactful. So if you have 3 or more ACEs, then you have 2.8 times the risk to smoke, 4 times the risk to have low life satisfaction, 6 times more likely to have problematic alcohol abuse, 7 times more likely to be a victim of violence, 10 times more likely to have problematic drug use. And if you have an ACE score between 7 and 9, you're 3.5 times more likely for fair or poor health in general, 4 times the risk for coronary heart disease, and 2 times the risk for stroke. And these are just things that happen in childhood. So this isn't even taking into adulthood. So we know that there's a really close connection between your health and the traumas you've experienced.
Well, and a lot of the traumas can come from people that are in really good family dynamics, like looking at a childhood, you're like arguably a super happy childhood, but parents got divorced, and even if they're amicable, that can affect the child in a really traumatic way. And as you kind of stack those stats are crazy. I haven't heard any of those. That's fascinating.
Yeah.
Where I want to go with this is, let's say, you have a patient or someone in your life and they have experienced trauma. You've identified that. Is the work through process that you want to identify the trauma and just learn to accept and work with it? Or is it to what is the solution? And a lot, this will tie into a lot of the conversation around psychedelics and things, but and you can maybe answer that in your own personal lens. Is the solution just to identify the trauma?
Yeah, it's a good question. I actually want to reverse or rewind and talk about the physiological mechanisms behind trauma and health, because then it'll make more sense when we talk about
Let's do it.
The solution.
Yeah.
Does that make sense? So when you experience a trauma or a stressor, they're pretty, similar in terms of if you're experiencing something really traumatic, you go into a sympathetic state, you go into a stress response state. And so when we see a lion or when we see a car crash, what happens is that our body starts by increasing levels of CRH, corticotropin releasing hormone, from the hypothalamus, okay? And then this is our startle response. So this is I'm alert, I have a startle response. You can actually increase your posture so that you're on the balls of your feet and hunched over so that you're ready to fight, flight, flee, whatever, freeze. And that CRH is also going to reduce sex drive, totally wipe out your appetite because there's no time for eating right now. We're experiencing something traumatic, and will stunt growth as well. So it's like, we're not going to grow anymore. We're not going to eat. We're not going to have sex. We're just going to survive right now, which is really important. We want that to happen. The other thing that happens is cortisol is going to increase downstream. That's your stress hormone. Cortisol is going to upregulate glucose production by the liver. Blood sugar levels will rise. And that is going to be so that you can feed your muscles so that you can run away if there's something that you need to run from. And then you're also going to have increases in adrenaline and noradrenaline, your adrenaline hormones, norepinephrine, epinephrine. And this is so that we can increase our heart rate, increase our breathing rate, dilate our bronchioles in the lungs so that we can get in more oxygen if we need to run away. You're going to dilate your pupils so that you're alert. You're also going to increase heart rate, blood pressure. I don't know if I said those ones. But all of these things are happening so that you can run away or fight somebody. So we want these things to happen. These are essential for a stress response. What happens though is when somebody goes through trauma, in PTSD, the thymus of the brain becomes dysregulated. And somebody can't understand if the stressor is still in the room or not. So it's like, originally if you see a lion, you have that stress response, and then the lion goes away and you're fine, you should return back to baseline. So that's called allostasis, where we go see a stressor, our body responds in the exact way I said, we're ready to run if we need to, the stressor leaves, we come back down to homeostasis. And so allostasis is what should be happening. But in PTSD, or when you've experienced a trauma that's too much for you to overcome, then what happens is we can get stuck in that chronic stress response. And so if you go through the list of what I said, decreased sexual arousal, decreased appetite, increases in blood sugar levels over a prolonged period of time increase your risk for diabetes, metabolic syndrome, increase in heart rate, blood pressure can increase your risk for cardiovascular disease. You'll actually get, your platelets will start to get sticky in a stress response because if you get cut, you want to clot right away. You don't want that long term because of the risk for cardiovascular disease. What also happens during a stressor is you shut off your gut and you shut off your urine output because you don't want to pee your pants and you don't want to poop your pants if you got to do something really important. We learned that at a young age. But what happens if you're in that chronic stress state now that you didn't come back down, but you're talking about weeks, months, years of being stuck in this stress response, is that your gut function is going to be shut off. It's not going to function well. You're not going to produce the right amount of digestive enzymes, hydrochloric acid to digest your food. You're not going to have normal motility, so you can see constipation or diarrhea or a combination. Bloating, one of the most common things. We know that people with higher ACE scores or childhood traumas have a higher likelihood for IBS, irritable bowel syndrome. So, all of these things compounded is how we actually have the correlation between traumas and physical health issues that can become chronic illness because you're not coming back to your baseline. And so, your first question of what do you do? It's based on this. It's like, how do we get somebody out of this chronic stress response?
So this is really fascinating to me. And the first thing that, I'm looking at this through the lens of my own personal stuff that I've gone through with gut issues, which I've, shared a lot about with you. And the other thing that comes to mind though, is as you're explaining like the width of all of these issues that can come up because of trauma, how often is a problem that someone is facing that is not, they got hit by a car and there's an incident that injured their body and they're recovering from that from a physical standpoint. How often is it not trauma related? Because it just feels, if it is unexplainable and there is not an instance where the diet isn't to blame or, physical movement isn't to blame or whatever, how often is it not trauma?
Yeah. And so this has been the most fascinating thing for me in the last couple of years, because in naturopathic and functional medicine, I think that this is a big issue, is that we are not realizing how many of our cases actually involve trauma and mental health. I think mental health is one of the biggest causes for chronic illness, and trauma being a big, big sector of that. And so, in functional medicine, one of my big qualms with it is that we say, oh, your depression and anxiety could be due to heavy metals or mold or all these things. And I'm like, I think that's a little bit of a cop-out some of the time. So I think that we have to be identifying, and it's not to say that it couldn't be a contributing factor. But I also believe that we have to be seeing, when did all of this actually start? And was there a trigger that was a trauma? Because you don't want to go down the road of supplement. We're going to be taking all these things to help your anxiety because we think it's actually coming from, whatever it is. Because I think a lot of it is actually due to a chronic stress response that could be triggered by a trauma. But that's where I'm at right now. So who knows? Maybe in the next 5 years, I'll be like, it's all heavy metals. I don't think so. I think when you're in dogmas, I think it's not all anything. And so, we have to step back and see, like, what is the bigger picture of this person? Is it mold? Is it something that's, toxic in their environment? Whether it's actually a toxin or toxic people or whatever. But we have to identify that there is the possibility that this is trauma too. And I think that we're underestimating those cases of it.
So, okay. I'm learning so much for myself just listening to you, but let's say, someone has an unexplainable thing that they're dealing with. What is the first step, I guess, in identifying, like, let's say you have a gut issue, which is, large. I know so many women, especially, and I know you do as well, that like they have this unexplainable thing with their gut. Like they're not operating as they should be. And it's like their new state of normal. And, maybe they were to the extreme of where you were when you were in that doctor's office and you were hopeless. Or they just like aren't feeling good every day. That's their situation. How do you go about identifying, if you have trauma, where it comes from, and then like how to heal it?
Yeah. So a good doctor should be taking a timeline on you. So how I work with patients is when they come in, the first visit, I'm spending like an hour and a half with people. And so I'm asking them, like, when did this first start? And then they say, they may say, I've had it my whole life. And so that's a big key right there. But if they're like, it was in my teenage years, then my next question is, okay, so when you were 10, you had no gut issues at all. And usually they'll be like, oh, no, I was constipated then too. And so you want to create a really distinct timeline of like how things have unfolded throughout your life. Because once you have that timeline, you'll have a much better understanding of what triggered what and how you got to where you are today. And so when I say timeline, we're talking about any infections that you've had. We're talking about, did your parents get divorced? When was that? Did you get divorced? Have you had any abusive relationships? Have you ever had, any sexual abuse that's happened? So I'm really pulling apart things from people. I ask everybody, if I were to cut off the top of your house when you were a child and I looked into it, as God or something from above, that's psychedelic already. What would I see? Like, what are the interactions like? What was your role as a child? Were you the caretaker of all your siblings, or, were you quiet? Was it to be seen but not, what is that? To be seen but not heard?
Yeah.
And so these are all things that we'll talk about. And a lot of times people will be like, why are we talking so much about my childhood? Like, I'm 54. And it's because I really want to see like how much of this has contributed to your chronic health issues. And so that's what a good doctor should do, is just like really get a thorough intake of who are you as a person? Like, what is your story? We talk about the hero's journey, right? In psychedelics, it's like, what is your hero's journey? Like, where was the crisis? Is this your crisis? Are you coming in because you're in the middle of a crisis right now? And were there a bunch of things leading up to it? And so that's where I start with people, is just like, let's try to figure out who you are. And then from there, I can start to tease out, how much of this do I think is trauma? And it may be that, okay, you have small intestinal bacterial overgrowth now because you have motility issues, because you had a really stressful thing happen to you 5 years ago. So we have to treat both of them. It's not like we don't treat the gut, but then we also have to say, okay, now we have to also get you through that chronic stress response. So a lot of the times I will treat the gut and I'll send them to a somatic experiencing practitioner to help them move through that trauma, or I'll send them to an integrative psychiatrist, or a combination of a few people.
Yeah, this is really interesting. And I also think that something that was really helpful for me, you took it to the extreme, like to the nth degree, where you were like, I'm literally going to become my own doctor. But a lot of people, their best solution is just to become their own citizen doctor. Yeah. And that maybe it's through peer support groups or, actually most people I know that have solved their own gut issues, it's through like peer-to-peer healing of like, oh, you went through this, what worked for you? Yeah. Or functional medicine. But it's like this full picture and like full acceptance. Like for me, I'm still on my journey, but a lot of what's helped is just the acceptance of like, actually there's some ownership in this. It's not like an outsourcing. It's not like a structural issue I have in my body. Like I've done, all of the things. And I know a lot of people that have done all the things and they're looking for the answer or the pill or the whatever it's going to be. And then, oftentimes what ends up happening is they realize like, I'm not prioritizing my social life, or I experienced this thing when I was younger. And like, then they start to unwind and their physical symptoms get better. And it's like, why you see community or, different health markers that don't seem to make sense when you look at the traditional like physical body, that far supersede any sort of, health markers that you would think would make sense.
Yeah.
So where I want to go with this is psychedelics, which is something that we share a passion for, and kind of breaking down, and maybe, starting with your own journey with psychedelics on like how they have played a role in your life, your current perspective on psychedelic assisted therapy. And then we can kind of like dive into some deeper points from there and like go into some like sciencey things, but cool. I'd love to start there.
Yeah. I've actually never talked about this publicly before, I don't think.
Oh my God.
So I'm nervous.
Honored.
I started my kind of journey with plant medicine in probably 2020. It was when I started to grieve the loss of my ex passing away. And my first journey was using psilocybin and MDMA. And the purpose of that was really around PTSD that I had developed because of his death. And also I definitely had trauma from the fact that I dated somebody who had a drug addiction for so many years. That was like very traumatic in and of itself. And so in that journey, that was the first time where I really dug into a spiritual side of myself that I didn't even know it existed, which is really common with psychedelics, right? A mystical experience is, we think, one of the big factors that makes them effective. People that have mystical experiences get better outcomes with mental health related issues a lot of the time. And I had that. I had a very mystical experience. I had a sense of, things are much bigger than what I thought they were. And then a sense of loving myself. And really, it was in that journey that I identified that, having dated somebody for so many years that was addicted to substances was the trauma in and of itself. And it was like this, oh, wow, like you went through that. Like, let me give you a hug. You're not realizing how much of this is, things that you've gone through. You're focusing on him, that he's gone, and like, what could I have done so that he wouldn't have gone away? But I didn't realize how much of it was like me grieving the loss of losing myself in that relationship too. And so I had been in therapy for, probably a couple months prior to doing that journey. And that was a pivotal change for me. Like I came out of that with this sense of, I'm going to be okay. And my life mission is not what I thought it was. Like I really need to pivot more and go back to the roots of naturopathic medicine and realize that we have the innate ability to heal ourselves, including me in this trauma right now. And so I went on to do several more plant medicine journeys throughout the years, including ayahuasca, single MDMA sessions where I just did MDMA around the PTSD. And just really invaluable to my healing journey for sure. I don't think I would have the same outlook. I know I would not have the same outlook and have been able to heal in the same way without the psychedelics. I do think I could have gotten there eventually, but maybe it would have taken a lot more therapy. And it was really that spiritual component that was so important to me. It's like, I didn't even know I was spiritual. And I was like, this is hugely important to who I am.
And it's not an uncommon story or like recount a lot of people that lose their spirituality or their sense of, any sort of religious affiliation or any of these things come out of psychedelic experiences, feeling spiritual and feeling connected. You call it different things, God, source, whatever you want to, like just this divine connection and this feeling of oneness. Like there's so many patterns. And I don't want to go too far down this rabbit hole, but like just a brief point on this is, the reason why you have this pocket of the world, is like 27% of the world that identifies as spiritual but not religious. A lot of studies, a lot of history is coming out to show that psychedelics were a part of ancient religion. A lot of Western religion was born out of psychedelic ritual. And there's some like controversy around these theories, but there's this book called The Immortality Key that I want to plug.
Yeah.
Have you read it?
Yeah.
Oh, yes. Okay. I think we've talked about it.
Mm-hmm.
That's fascinating.
Yeah.
If you just want to look at like the history around some of these things and, just to bring it full circle, the reason why I mention it is, why do we have people that go through psychedelics and identify all of a sudden as spiritual but without the church anymore? Mm-hmm. It's because maybe the church lost the psychedelics, so it's an interesting point.
Yeah.
What I would love you to kind of explain, and I asked you this question before, and I don't know if I worded it that beautifully, so I'm going to try again. Just in the same way that like herbs work in our body, we're kind of talking about two different things here, like the physical symptom. Like if I have something that like I have a pain in my wrist, or, we'll just stick with the stomach because this is the common theme. Yeah. I know a lot of people that have gone into a psychedelic experience. The most common one I hear people talk about with physical ailments is ayahuasca. Mm-hmm. And going into that experience with a physical symptom and coming out symptom-free. In your opinion, are they coming out healed because they've healed the trauma? Or is there also some sort of a combination, like, ayahuasca, psilocybin, these plants, these fungi? Is there something in the compound that's also healing us like herbs do? Because we know a lot of people talk about the long-winded question. A lot of people talk about the, cognitive neuroplasticity within, what psilocybin gives us and all the things with the brain, but specifically with like the physical stuff. I'd love to hear your perspective on that.
Yeah. This is really interesting. And I don't know everything around this because we don't know most of what's going on with psychedelics yet. So I'm really excited for us to dive into that research where we start to learn actually how the compounds are interacting with our cells and what cascades are going down. We know a little bit about them now, but most of what we know is like focusing on the serotonin 2A receptors. But we know that there's likely way more interactions beyond that. And so when I hear like somebody has a healing crisis where, they have an issue and then they go through and do ayahuasca or something and then their issue is solved, my biggest thought around that is that it likely was something that they were holding tension in their body. So we talked about earlier that the release of CRH from the hypothalamus causes us to change our posture, roll up on the balls of our feet, and create this tension, right? And so that tension, in my mind, can then lead to joint pain, arthritis, cramping in the stomach, just like holding tension within the body in general. And so if you go through and do plant medicine and you realize that your symptoms are solved after it, then I have to wonder, is this something that was chronically tense in the body that was creating the symptom and you've said, I'm going to let go of it now? So I think it's probably both in terms of it could be a hormonal response and maybe you're down-regulating some of those stress patterns that are actually causing the tension or the pain or the discomfort somewhere. But then also, is there an actual just emotional release that happens there too? I 100% think so. When I work with people, sometimes I'll have them do a body scan in my office. And especially if they have stomach issues, I'm like, what do you notice right now? And they're like, oh, it's tight. Like I feel like tightness there. And then I'll just have them like sit with that. Like just notice it. Don't do anything. And it almost always changes, dissolves, goes away, comes back. And so what we once thought what they once thought was totally biochemical, they realize they actually have some control over it. And so, psychedelics put you in a whole different plane of your ability to change your perceptions around things. So I think it's probably both of them.
I had a recent experience. This was separate from psychedelics. with a nutrition response therapist, which is, I don't know too much about, but it's muscle testing. And this practitioner was feeling my stomach and felt this area of my stomach. And there's, I won't pretend to know the science behind how this works, but was like, ooh, like your, this part of your colon isn't working. And then he asked me, these several set of questions, which was like probably the most woo like health thing I've subscribed to, but I was fully in it at the time for various reasons. And also the guy is brilliant. And what he kind of got to was like, ooh, something happened to you when you were 3. Based on this set of yes or no questions that has caused this to not be operating at its fullest potential. And like the drawing of awareness to that, however you get there, whether it was something like that or through psychedelics, I was like, ooh, interesting. Like, and I haven't solved it, but now that I know that exists or like what this could have come from, I'm like, that's really interesting. And then I also wanted to point this out because, some people will go into psychedelic experiences, whether it's a psilocybin ceremony, MDMA ceremony, ayahuasca, and expect this like cure-all for their thing.
Yeah.
And sometimes people get it. They go in there like one and done. Like they walk out amazing and they've never felt better. And then some people, it takes, years of like uncovering different things or there's like a layer. You like get to the first layer, like you're saying. You're like, all right, I figured out, I'm looking in the top of the house. I saw this happen. And then once you identify that, you can go like a layer deeper. And so I just wanted to point that out. And, if you have any other thoughts on just like the layers and I kind of want this to like veer into like, the downsides of psychedelics and the fact that they are not silver bullets, but they can just be massive spotlights into things and clues.
Yeah. Yeah. And we have to be really careful because, just like CBD had its like fame, right? And like marijuana and all these different things. It's not a panacea. It doesn't solve everything. It's not going to help some people. And it is going to help some people. But I think that, if you think that you're going to go into a plant medicine journey and solve your issue right away, then I think that is a little bit of spiritual bypass too. Because, we say like in plant medicine, anybody can see something, go through the journey and see it. But the real magic happens afterwards in the integration period, especially in that critical window that exists after a plant medicine ceremony. And so, I think that if you've had a trauma that was 5, 10, 20 years ago, to think that one 6-hour journey is going to solve it, I think that's a little bit small-minded. I think we have to really view these as, these are complex things that we need to work through. And the integration it's essential. I know you've had other people talk about the integration on your podcast. And I really do think that's where the majority of the work actually happens, is like starting to pull off those layers. So, some of the stuff that I did, like it was one journey and then I did, 4 weeks of therapy after it, which, 4 hours of just sitting with somebody, pulling apart each of the things and working on them. Because just looking at it doesn't help. You have to actually start to integrate it into your life and make the changes there too.
And it's like, it's somewhere in the middle, right? Like it's not a silver bullet and it's also so powerful, right? Mm-hmm. Like there's a reason why so many people are excited about psychedelics. And like even, I'm currently testing a D2C ketamine lozenge situation right now. And there's a lot of thoughts around that. So like we don't need to dive necessarily into that rabbit hole because like a lot of the conversation around ketamine and all psychedelics is that psychedelic assisted therapy should be used in combination with therapy, exactly what you're describing. Mm-hmm. And that's the most powerful result. But all that being said, because I've had, I've used ketamine before, I've had, ketamine assisted
you're experienced.
Therapy. I had such a profound experience last night where like the ability for this to pull me out of a rabbit hole that I was in mentally, it was so fast. It's like an hour in and out and like total changing of the state, which has happened for me before. And, like with fitness and like doing certain things that can change my state. But I came out of the experience and was like, wow, I cannot overstate the value that this had for my life. And within such a short period of time, like again, I could have gotten there maybe like take another, a few days to process various things. Mm-hmm. But it was so powerful and so quick and just an immediate state change. And I came out of it being like, wow, I think obviously I am, but I'm such a believer in the variety of these medicines. Like that was ketamine, and each one kind of has a different use case. So I just wanted to say that where I'd kind of like to go next, we kind of touched on it, but something you're really passionate about and you speak so well about is testing your drugs, overdosing, all of these negative effects from the recreational side. Like this is totally separate from therapeutic usage, which, the products, if it is a legitimate company, should be safe and vetted. So you're usually fine there, assuming that the practitioner knows the dosing and all of that. Yeah. But from the recreational side, psychedelics are going to be used no matter what. Like yes. Drugs will be used. What are your thoughts on how to use them responsibly and just some things that you're passionate about?
Yeah, absolutely. It's the same idea with, teenagers having sex or not. Like the abstinence approach to sex education is useless. And we know that now, right? You can't just tell teens don't have sex. So we're giving out condoms and saying have sex safely, right? And these are all the things. It's the same with drugs in my mind. Humans have been using drugs for tens of thousands of years, right? Like you're talking like BC is when marijuana started to be used. Opium was BC years to like 400 BC or something like that, crazy. And so to think that all of a sudden we're going to stop using drugs is absolutely crazy. And I don't think it's the answer either. And so it's a harm reduction method that I think should be in place where we are testing our drugs and making sure that we're getting the cleanest substance possible. So, what the big issue is that these drugs aren't regulated because they're illegal still. And so if they're not regulated, then where are they coming from? Who's growing them or who's making them for the synthetic things like MDMA? And are they being laced with things? And we're seeing that the answer is yes, they're definitely being laced with things. And so what I know most about is fentanyl. It's an opioid, and it's, one of the leading causes of death now in young adults is overdoses. And so we saw a huge dramatic increase in overdoses with the increase in synthetic opioids like fentanyl. And so you want to make sure that you're testing all your drugs. We used to think, okay, we know cocaine has been laced with fentanyl, which is an amphetamine, but now they're seeing ketamine laced with fentanyl. They're seeing MDMA laced with fentanyl. And so, you don't want to be naive in this. There's just 2 high schoolers that passed away in the Northwest because they took what they thought were prescription, I think it was Xanax or something, but they were counterfeit pills and they were laced with fentanyl. So you really need to make sure you know what you're taking because, I don't think we're going to stop using drugs, but you got to use it safely. So there's fentanyl test strips you can use now, and Overdose is the company that I've helped out a little bit, and they send fentanyl test strips to your house. I also think if you're taking any recreational drugs that could be laced with fentanyl, which is pretty much all of them at this point, then you should have a prescription of Narcan, naloxone on you. And I don't think that this is overkill either. I really don't. And the worst case scenario is that you have to use it, and ideally you have it on you and you can help save somebody else, or you're educating your friends on it and they're saving you. I mean, it's an opioid antagonist. It blocks the receptor and it can really save somebody from an overdose. And so I think we need to be educating our youth about this. It should be in every high school, middle school education process is, these are the drugs. These are what they actually do to you, not what we thought that they did to you that people are talking about, right?
Total rewriting of the DARE program.
We have to totally revamp all of our drug education because we should be teaching harm reduction. We should be following the suit of, sex education. We're not teaching abstinence in most schools anymore. Same with drugs. We should be really teaching harm reduction. Instead of don't take drugs, what are the lethal doses of drugs? What drugs shouldn't you mix with prescription drugs? How do you test your drugs? Give out fentanyl test strips at schools. Give out naloxone at schools. I think this is all possible, and it's starting to get underway too with some of these companies like End Overdose, but we need to be talking about it more. So my thing is if you're listening to this podcast and you have a child, are they teaching this in their high school? If not, get it into the curriculum because we can do that at the individual level.
And the hope is also that, like, in parallel with harm reduction methods like you're describing, that the legalization will also catch up. Because, Shelby Hartman from Double Blind, she's brilliant. She was just on the podcast, and one of the things she said that I was it feels obvious but not really talked about, like the largest problem with drugs right now is because of the fact that they're illegal. And if you look at where are most people getting their drugs from, if you were looking at like just, like the LA community, most people are getting their drugs from a guy who knows a guy off a random number on Signal, which is a messaging app, or, like, sorry Signal, if it's like, that's the primary use of these messaging apps that don't have traceability. And it's sketchy. And what I've, learned, because I've tried to have a pulse on what's happening with black market psilocybin products, because I'm very passionate about it and bringing those products above ground, because I really believe in psilocybin microdosing in addition to these macrodosing at service centers, which are both equally as powerful. And like you're saying, abstinence is not going to stop. People are not going to stop purchasing products. Actually, it's dramatically increasing as psychedelic education is coming out and people are realizing how powerful they are. And I think, hopefully, like, the hope is the harm reduction stuff is happening, but then also in parallel, these products start to become above ground. They start to become legalized and we reschedule psilocybin, MDMA, like it's in process, but conversations like this hopefully will move it forward and communities will gather around the need to do this quicker at the state and local level. Because what I've been spending a lot of time thinking about is the consumer product side of things. Because, from your world is the clinical therapeutic use, but, like in the social world, these drugs are going around and the risk of something being laced with fentanyl is so real, and we're seeing it like just in communities that we're a part of.
Yeah, no, it's definitely scary, and I think legalization is definitely something that could help with preventing accidental overdoses for sure. And I think there needs to be a lot more drug education too. It's like one of the things, like the downside of psychedelics or the downside of like this industry in general is that there's going to be deaths with psychedelics. So we don't want to be naive either, but can we start to educate people around them? And, there's certain conditions that maybe we shouldn't be suggesting them for, or if you have a family history of, schizophrenia, bipolar, we don't know if, that's going to be a good option for those conditions. So we want to educate more. We want more research. And I do think legalization is part of that.
I would love to ask you now kind of about something that I get asked about a lot, and I don't really have a great answer to it because the research is limited. So you may not have a conclusive answer because the research is limited, but SSRIs and psychedelics. A lot of people are looking for alternatives to anti-anxiety and antidepressant medications. And this is also like massive caveat on this is like that psychedelics are still illegal. Psilocybin is still Schedule 1. Yeah. You cannot legally get microdosing. But let's say, like in therapeutic settings, there are doctors I know that are legally helping their patients get off or avoid maybe the use of SSRIs with legal psilocybin. And can you just speak to kind of like the interaction of those two, whether you need to be off, one of the first questions I ask you if you go down to whether it's out of the country to do a psychedelic ceremony is, are you on SSRIs?
Yeah.
Can you speak to the interaction and what people should be looking for?
Sure, for sure. And we don't know everything yet. So with a lot of the psychedelics, especially the classic psychedelics, you're looking at their interaction with the serotonin receptor as being one of like the main mechanisms for a lot of the effects that people feel, especially the euphoria that's experienced. And so what happens if you're on an SSRI, we think, say you're taking an SSRI and you wanted to do an MDMA journey in a clinical trial or something. We believe that it's going to be blunted response. And so that blunted response is because the SSRI is blocking the receptor that MDMA would normally push out more serotonin with. So it's actually blunting the effect that the MDMA is going to have. So you may not have as much of a psychedelic experience. And so, there's also the idea that, could any of these cause serotonin syndrome, which is the overproduction of serotonin? We think it's more the blunting that's going to happen in instances like this. But that's exactly why when you go to an ayahuasca retreat center, you won't be accepted likely if you're on an SSRI, because there's the concern with, mixing an MAOI, which is what ayahuasca does. It's an MAOI inhibitor, or an MAOI, and an SSRI that you're on, or if you're on an MAOI as well. And so, we need to take these things in consideration. But what the recommendation usually is, especially in the clinical trials, is you have to be off of, SSRIs for depending on the actual medication, like 2 to 6 weeks before you can actually do the MDMA guided therapy, because it may not have the same effect. It likely won't have the same effect on you. And so you'd have to go with a practitioner, taper off responsibly, if you think that's even an option for you. Sometimes being on the SSRI is a better option than doing the MDMA guided therapy. You have to make that decision with your psychiatrist for sure.
And thoughts specifically on psilocybin interaction as well. So there's more stuff around MDMA because of the serotonin issue, but psilocybin interaction with SSRI. Do you have any research on that?
I don't know as much about it. I don't know as much about it. You still have the serotonin 2A receptor that's being activated there. So potentially the same thing, but I don't know as much about it versus MDMA.
And hopefully there will be more research coming out around this, because it is a lot of conversations around, people that are, whether it's therapeutic settings or looking to use recreational psychedelics, and there's a lot of people that are on some sort of a medication that could have a contraindication. So I think that's important to look at.
Yeah, you definitely want to do some research before doing any of these things, because there is the risk for serotonin syndrome with some of these psychiatric medications. There's the risk for blunting the response, but obviously the more serious one is going to be serotonin syndrome, which can be fatal. The other issue is that, this is a big concern of mine, is if somebody has a blunted response because they're on a medication, are they going to just keep taking more of the drug? And we don't know if it's blunting all the response, which means that, MDMA, for example, increases heart rate, can increase body temperature, can, possibly increase blood pressure. So just because you're not getting the euphoric feeling or you're not getting the high from it doesn't mean you're not getting other physiological things happening in your body. So taking more and more and more, could be a real issue. So we want to be really, really careful with that just because you're having a blunted response doesn't mean that taking more of the medication is going to be safe. So real concern with that.
Yeah, and I'm excited about more of the studies that are going to this exact conversation. So hopefully in like a year or two we'll know
so much more.
So much more. I've learned so much during this conversation. I have a few more questions for you, like more on a personal level. You've been on this journey. I think your focus area right now will continue to kind of evolve, and I'm excited for you to look at more research, because you're so good at distilling it to the common folk like myself that are not in the functional medicine space. And with everything that you're looking at and passionate about right now, like what is the intention? I know it'll shift because you're still on the journey, but what do you hope that your work impacts the world? Like what is the effect that you hope it has in 5 years, 10 years and beyond?
Absolutely. Yeah. So when my ex passed away, the day that I found out that he died, I really went internal and I was like, mental health is going to be a part of my career. And so that was like a distinct moment that I had this realization that I'm on this planet to change the narrative around mental health stigmas, and addiction too. So I have a real desire to be in that world because, this is an important part, but like with a hero's journey, you have to make meaning out of the traumas that you experience. So that's part of the healing process through trauma, is creating meaning around it. And for me, there has to be meaning around his death for me to be able to move through it. And so that's a big one for me, is really going into the mental health world, which is going to include the use of psychedelics, ketamine, in my practice as well. And making a change there and just getting people talking about mental health more. I've gone through my own mental health things, and they will continue to come up, and they have continued to come up in my life, and to start to normalize them so we can all be more vulnerable and connect around them, I think is really important for my healing journey, and my career path.
And when you see people, obviously like, you're one of my closest friends. So we have conversations on like a super personal level about stuff that we're going through in our lives. But what I think is even more important is when people see someone like you that is in the field that you are in with, it's Michael Pollan is an example of one of the most impactful people that has made the largest shift in the narrative around psychedelics specifically, but, in larger part, the mental health space. But he is successful. He's, has studied medicine and food for how many, I don't know, like a decade plus, which people have known him in that world. And so when people start to come out of their kind of mental health closet or psychedelic closet and really be vulnerable and share their stories, it really shifts narrative, because there's so many people that will identify with so many things that you've said.
Yeah.
And then start to explore the options that have also worked for you. Mm-hmm. So thank you for doing that, first of all.
Of course.
The last thing I want to ask you is, this is a podcast about psychedelics. So we always kind of bring it back full circle. Is if you had to pick one lesson that psychedelics have taught you that has been the most impactful on your life, what would you say?
Oh, one lesson. That's so hard. We're all trying our best. I think that's a big one for me. I've learned so many lessons in the plant medicine journeys, but I think this idea that as humans, we're all trying our best. And I think when you're going through something with somebody, just realizing that other human is also trying their best. I really do believe that. And I think that it creates a lot of compassion and empathy for other people too, if we kind of put that into perspective, that we're all just trying our very best here. And it's tough.
Mm. And we have a mutual friend, Peter Crone, who says this all the time, but and I love it because it helps me a lot when I'm thinking about why I'm saying certain things or doing certain things, and like every experience in our life leading up to this moment where I couldn't be saying anything differently to you. You couldn't be saying anything differently to me because of all of our experience to date that has led us to this thing. And I think it's it's in theme of what you're saying. Like, we are all trying our best and only doing what we have the training, the capacity to do in that moment.
In that moment, yeah. And that may change later down the road when we have more tools. But right now, right here, we're using everything that we have to do our best.
Mm.
Yeah.
Okay. Last few questions for you. Just on, a logistics front, what is next for you? What are you most excited about in the next 6 months? And where can people find you?
Cool. Yeah, I'm right now undergoing the somatic experiencing training to bring that into my practice to help people move through trauma. And so that's on my docket. I'm basically back in school for the 3-year program. And so that's really exciting for me. And other than that, I'm writing a gut health course on IBS constipation. And so that will be available, who knows when, I should probably put a date, but in the next year. And getting certified in ketamine-assisted psychotherapy too is on my list of things to do, or ketamine therapy, I should say.
Amazing. You have such a clickbait-worthy array of skill sets and interest areas. I feel like in the future you could write a book on psychedelics and poop, You're just accumulating such interesting things.
Thanks, Boo.
Well, I'm really, really excited for you.
Thank you.
I learned so much from this conversation. I know everyone will too. And I wish that we had this Slack line tied up so I could just send you back over the balcony.
Soon.
We'll have to have Travis come assist us.
He's going to demo it for sure.
Yeah, definitely is going to demo it. But I love you a lot, and I'm so excited for everything you're doing. So we'll link up where everyone can find you, your Instagram and all that. Definitely check out Mary's Instagram. She always posts amazing infographics, and can't wait to see what you do next.
Thank you for having me. You're doing such amazing things on here. I love you tons.
Love you.
Thanks for diving into the multiverse with us. If you're interested in being a future guest on the show, sponsorship, partnership, or you're just mushroom curious, we're always looking to expand our mycelium network. Find us on Instagram at Multiverse or online at yourmultiverse.com. See you next week.